Hello, everyone. I'm Laura Brown, and I want to thank you for joining me today for this webinar on Calmare Pain Therapy. Let's get started. Would you like the confidence to live the life you deserve without the pain that holds you back? Would you like to play with the kids or work around the house without paying for it later, with debilitating pain as your currency? Would you like to shed that not-so-good old friend that you've lived with for so long and have the energy to spend on the things that are important to you? Would you like to achieve this without more pills that wreak havoc on your organs or are addictive in nature? Of course you do. That's why you're here. I'm Laura Brown, a health professional and practice owner, and I'll be taking you through some valuable information today that will hopefully put you on the first step of your pain-free life. I want you to have a life you love and those around you will love for you. We all want to live our best life and make the most of our time, whether we are at work, play, or spending time with family or friends. After all, what else is there in life? I need one thing to help make that a reality, and that is you. First, I think it's important to understand a little bit about acute versus chronic pain. This has been a major roadblock to successful treatment, as most healthcare professionals are still subscribed to a theory that does not apply to both. Most pain we acquire begins as acute pain. Damage to tissue occurs and pain lingers as this damage is healed. And this is actually a good thing. It's a protective mechanism. Once the damage is healed and tissues have normalized, the pain should go away. It is generally accepted that 3 to 6 months is enough time for healing to occur, and that pain lasting longer than this is considered chronic pain. In most cases, this is not productive, but just a vicious cycle that the brain is looped in. Founded in 1965 by Ronald Melzack and Patrick Wall, the gate control theory became the predominant theory, offering a physiological explanation for the previously observed effect of psychology on pain perception, thus revolutionizing pain research. It is theorized today, however, that this theory may adequately explain acute pain, but that it does not apply as well to chronic pain. Chronic pain no longer has correlation to tissue. It stays longer than is appropriate or grows disproportionately to the insult. In 1999, the pain neuromatrix theory was born, giving way to the threat neuromatrix. In a nutshell, this theory asserts that hardwiring of protective mechanisms has occurred across multiple brain areas to elicit certain responses. These are learned responses and are codes interpreted by the brain. This is where Calmare Pain Therapy excels in treatment of chronic neuropathic pain. It is designed to send new non-pain coded information to be interpreted by the brain. This code becomes the dominant signal over the previous erroneous pain code. You may find yourself on a common treadmill. No healthcare practitioner owns pain, as most conditions that have pain associated with it are treated by many different specialties. And most education we receive is related to acute pain, not chronic. Updated scientific study supports that chronic pain is a problem of the brain, and yet we subscribe to therapies that address tissue or drugs that impact the entire chemistry of the body. Talk about one exhausting treadmill. These common treatment options may sound familiar. Medications such as opioids, neuroleptics, and antidepressants. Although these are helpful to some, the challenges of side effects and the difficulty weaning off of them leave much to be desired. Physical modalities such as massage, ultrasound, iontophoresis, and traction have been known to provide short-term relief but not have lasting effects for chronic pain. And electrical stimulation machines, namely TENS and implantable stimulators. True, TENS can be worn, but does not show long-lasting benefits. Implantables are either peripheral or spinal cord stimulators. These require invasive procedures, and more studies are needed before speaking to their efficacy. Injectables like epidural steroid injections are, again, invasive and costly, with a mixed bag of results. And then there are nerve ablation techniques, which are designed to use radiofrequency to destroy targeted nerve fibers. This comes with a high cost, no guarantee of success, and repeat procedures are common. Last but not least, there is surgery, which, with its hospitalization and anesthesia, can run into the tens of thousands, also with a high percentage of patients not receiving lasting pain relief. This is why I beg of you, get off the treadmill. Get off the treadmill with the pain model disruptor of Calmare Therapy. Calmare is a natural alternative to treat neuropathic pain. It is non-invasive and without side effects. Pain relief is immediate and, following a series of treatment, long-lasting. I bet I know what you're thinking. If it is this good, why haven't I heard of it and why isn't it being used? Am I right? Well, simply put, Calmare is time intensive for a practitioner. There is no quick in and out. This is a treatment session, not an injection or a pencil whipped prescription. It also challenges theories and models people have held on to for years. There is resistance to change, and in this healthcare climate, there is certainly resistance to increasing patient interaction time. So, what else do you need to know about Calmare therapy? Calmare is not for everyone. This is a treatment for those with a clear diagnosis of neuropathic pain. There are contraindications that must be taken into consideration and medications that need to be weaned prior to beginning. Calmare is a daily treatment until there is 48 hours of no further change. Those who cannot commit to an hour a day for, on average, 2 work weeks should not continue. It is for those who are tired of settling for less than the best. It is for those who are leaning forward wanting to know even more. It is for those who value a drug-free solution. It is for those who are willing to put in the time, and it is for those who value a specialist who can be laser-focused. Sound good? Are you ready? Click on the link and schedule a one-on-one phone consultation where I will assess that you are a great candidate before you even need to come in. Still not convinced? Hear from others who have had Calmare. Kathleen, a 49-year-old music teacher, had this to say. I am young. I want to do things like play instruments and paint and write, things that involve my hands. Having tremor in my right hand, my dominant hand, is very difficult emotionally and physically. The treatment was important because I had hoped it would decrease the tremors. Honestly, I was trying not to expect much. I knew I could only have 3 sessions at this time, and to make permanent change, I would need more visits. I also didn't want to get my hopes too high. During the Calmare session, my tremors did subside. For a while, my hand was peaceful. Laura also treated my jaw. My teeth chatter, and I find myself grinding them together. What happened that I didn't count on was the relaxation of the rigor in my right arm. As a teacher, I often walk around my students in the classroom. As I walked, my right arm would be bent with rigor, my hand looking like a claw. I had much welcome relief for a long time from rigor, over 2 months from such a limited treatment cycle. I will do the full cycle of treatments. And Steve had this to say on behalf of his wife. My wife has been going for treatments with Laura, and they have made a tremendous difference. The pain relief she has experienced is amazing, almost too good to be true. I thank God for this to give my wife some release. She has just tried everything in the last 4 years, and nothing compares to this treatment. If you are in constant pain, please do yourself a favor and try the Calmare protocol. And Ralph, a retired carpenter, said, I was injured on the job 24 years ago and have suffered low back and leg pain to varying degrees ever since. I thought I was doomed to live with that for the rest of my life. Despite some skepticism, I gave Calmare therapy a try and was surprised and very happy with the results. I am doing more without pain. I'll definitely be back when it's time for a booster. And finally, Mr. JM said, I have been suffering from severe pain. On a scale of 1 to 10, it was a 10. After treatment, it was about a 2. I am sleeping better and have been pain-free for over 3 weeks now. So if you think you are ready, but still have some questions, sign up now so we can get started on a new version of you. Thank you for spending this time with me. I hope to be speaking with you very soon.